few minutes. So my name is Christiane Kearns. I'll be facilitating our session today. I've acted as the Interior Regional Manager for the Rural and Remote Division for about 3 years now. But I've actually just recently, as of this week, transitioned to a new role of PCN Planning Manager. So that's quite exciting. And so this PCN forum has been very enlightening so far as we try to get some service plans and PCNs created in our division, because we've yet to have one, and our first community going forward is Revelstoke. And so, yeah, we're really excited to learn more about the evaluation component of primary care network planning. Of course, it's an expectation of the ministry that you have a robust evaluation plan, and our presenters today have lots of expertise and knowledge to share on how to do a proper evaluation and how to, set up a good evaluation framework to ensure it's comprehensive and including various voices. So I'd like to introduce you today to our two presenters. We have Katherine Coatta and Stephen Reichert of Reichert and Associates. I'm sure many of us at the division level may have worked with Reichert and Associates before. I know our division has utilized their great skill sets for evaluations in the past. And so, yeah, I'll just turn it over to either Katherine or David Stefan, and please lead us through this very enlightening conversation. I'm looking forward to it.
Awesome, thank you. I guess I'll start out with, I think I know most people on here, but if there are some, for those that don't know who we are, our team is focused on healthcare evaluation. We've been working with divisions of family practice for the better part of a decade, almost since divisions first started. And we work pretty much across the province. Some of our work has included the evaluation of shared care, specialist services committee initiatives, a GP for me, PMH, and now PCN planning and evaluation. We serve a lot of purposes with some of the divisions that we work with. We do a lot of their data work on top of that, so we're doing AGMs and things like that. We're also involved in a lot of provincial evaluations. So our team is recently been involved in, we're doing the Rome evaluation provincially, which touches on a lot of rural communities. We recently completed, or actually we're still working on a last phase of the nurse in practice evaluation that's been going on across the province. And we were also involved in the population-based funding evaluations that have happened in the province through GPSC. And recently, one of our big pieces of work was the evaluation, the completion of the evaluation of the provincial overdose emergency response. So our team is well experienced in primary care in BC, and it's our hope today that, some of the experience that we have and what we've learned and what we're learning will be useful for folks, whether you are working with us or not. That's not the consideration. It's to develop a robust evaluation provincially and make sure that we're all learning things and sharing them. So I will turn this over to Katherine. Katherine from our team is our internal PCN lead, and she has years and years of experience working across the province evaluating primary care initiatives, and has a good understanding of the data and where it's coming from and what some of the key things we should be looking for are.
Thanks, Stephen. And we also just wanted to acknowledge today that myself, I'm joining from the traditional unceded territories of the Coatta and Tsleil-Waututh people in Port Moody. And Stephen, I think you're at the office today, right?
I am, and so I was trying to figure that out, and I wasn't doing a very good job of it. But I am joining from the traditional unceded territory of the Squamish, Tsleil-Waututh, and Musqueam nations.
Yeah, you can tell we aren't in the office as much as we used to be, so we have to take a minute to think about that. Yeah, thank you so much for joining us today about our conversation about evaluation. I see lots of familiar faces on the call, which helps me settle my nerves a little bit. It's always, a bit nerve-wracking going in front of a panel of people and sharing what we know and what we like to do. I picked this picture of my daughter here. This was at Harrison Lake this summer, just representing curiosity. That's something I hope that, or we always try to bring to our evaluation work, just being curious, trying to learn new things and to share them back with people we're working with. So let's start there. And just seeing how this controls. There we go. So Leanne asked us to come and present about evaluation for the PCN, but I just thought we'd kind of take it back a step and just think about what does evaluation mean, and how is it different than other forms of inquiry like research or quality improvement. And so I took the definition from the Canadian Evaluation Society, and I really like this one because it talks about evaluation as a systematic assessment starting with the design, implementation, or results of an initiative for the purposes of learning or decision making. And I would also add to that sharing, because I think that's an important piece too. I think I really like this definition because it doesn't talk about just kind of coming in at the end of an initiative and looking at just the outcomes and what's happened, but being a part of the project design right from the beginning, asking questions like, are the right people involved right from the beginning? Are we creating something that actually is going to meet the needs of the people that we're trying to serve? Throughout the implementation process, what are we doing well? What are we doing that could be done differently? Again, are all the right people here for while we make these changes? And then it is useful, of course, at the result stage 2 to look at what did change, how much of an impact are we having, and what's still left to be done. So I really like that. I also really like that it highlights learning and decision making, and like I said, sharing as well, because no implementation is ever going to go quite to plan. We're going to learn along the way, and we also want to have data to inform evidence-based decisions. So helping be part of that process too is something that I think is really valuable about evaluation. The link at the bottom here, I can share it out maybe in the chat in some way, but it's just a great little couple-minute video that goes over how evaluation is different than research, although there's many of the same methodologies used. It's more intended to be something that's useful to a project, and something that is grounded within the context of what's working well, what isn't, and why. Whereas research is more maybe trying to add to a broader scientific body of knowledge and broaden the applicability from there. So that's just one kind of key difference there. But a great little video if you're watching it, or if you're trying to share with others in your organization what evaluation is and why it might be useful or important. It was created by the PHSA with Dr. Beth Snow at the helm there. So great little video. So generally our approach to evaluation, we focus in on these 3 key things. And so the first one, participatory. What I mean by this, like some of these are just big words, and I want to just give more of a real example of what we mean when we say we want it to be participatory. We want the people who are using the evaluation, who are impacted by the evaluation, who the evaluation is about, to be part of the process of designing and implementing and understanding the results of an evaluation. And the ways that we've done this within the projects that we've worked on, and specifically within PCNs that we're working on across the province, has been developing evaluation working groups, having interviews with key stakeholders to help inform the development of an evaluation plan, and then having those people stay involved with us throughout as we're developing data collection tools, as we're getting findings back in and helping to interpret those findings, and then as we're being able to share those learnings with other people. And so what this results in is that the evaluation is more grounded in the actual needs of the people using the findings. It also helps to eliminate risks of the questions we ask not being relevant or being, possibly offensive, making sure the language that we're using is the most appropriate and current language with the stakeholders that we'd be, for example, having in a survey. And so just really makes all of the work just that much better, having people that are bringing a skill set to the evaluation, because we bring specific skills around understanding how to create a survey, understanding how to employ certain methods, but we don't always have as much knowledge in terms of specific local contexts and specific populations and specific perspectives. So creating a team around ourselves to make sure the evaluation is really useful, which is our second point, utilization focus. So again, big word. And really what I mean here is that the evaluation is able to help impact the project, that there's things that we can learn from it. So we really strive to produce work that helps us understand what's happening, tracking changes over time, and pointing out opportunities to improve. Some of the ways that we've been useful already in evaluations we're working on with PCNs, for example, we're able to conduct interviews with new nurses who are onboarding in a specific PCN, and then provide the findings of that back to the change management team. And they were able to adjust how they were doing their next round of onboarding, changing up their orientation process, getting the nurses into the clinic sooner so that they could get a sense of what's happening in the clinic versus doing a lot of early theory work outside of the clinic and then bringing them in later, and just improve that process for them so that they felt like they could learn a lot better by having that earlier visit to the clinic just to get them grounded in it. Another way is by being able to collect data that is around the experience of care. So developing tools that let us know how the patients are experiencing these changes, whether the numbers that we're seeing in terms of attachment, what does that actually mean from the patient perspective? So be able to provide that kind of data back to the project and continue to help them see the impact that they're starting to have. We've also, in terms of making our findings useful, we really work hard to make the data that we share in a useful format. So we've spent time on data visualization as a team, on storytelling, so that we can convey findings in a way that's easy to understand and actually apply from there. So we use 2 page handouts, graphs and quotes to highlight key findings, that kind of thing, to try and bring those messages to life. Third on here I have is developmental. So we don't take a super strict developmental approach, which would mean, it's quite open and there's not a lot, written out from the start. We do create an evaluation framework from which to base all of our work from, but it's evolving with the project. So as we learn new things, as for example, for PCN, we're watching the development of an evaluation framework provincially. So when that is created, we'll be able to apply that to any evaluation plans that we have locally, allowing us to align with the provincial requirements while also serving the local needs as well. So that's a goal of ours as well. And another piece I don't specifically have kind of highlighted here, but fits within here is being culturally safe. And so starting to, be inquisitive about how we're doing evaluation and making sure it's done in a way that is decolonizing. We're not doing things just because it's the easiest way to collect data or something like that. So trying to think about how we're going to reach vulnerable population groups and specifically Indigenous people, First Nations and Métis through this work. Stephen, do you want to speak a little bit to this piece here, the work we've been doing with Gracie Kelly?
Yeah, sure. So we are working with one of the divisions that has 21 Indigenous communities in it. And because we're seeing what's happening in other divisions across the province, we were looking at this and saying there's something different going on here. There's definitely an opportunity to learn from what's happening here and bring that to other divisions that we knew were struggling in certain areas, especially ensuring that the work they were doing was good in terms of working with Indigenous populations in their communities. And so Chilliwack has Gracie Kelly, who is their Indigenous relations manager. And she is just doing such an awesome job in their community, working with Indigenous communities and bringing that and ensuring that all the work that we're doing evaluation wise, as well as the division as they implement their PCN, culturally safe and meeting all of the community needs. We brought that back to one of the other divisions who was struggling, and we said, let's get Gracie to talk with you about this. So I'm just going to add one more thing, is that one of the things we really strive to do in all of our evaluation is share information wherever available. I truly, and our whole team truly believes that that's how things get better, is if we develop a system, and part of that system requires us to be sharing information.
Thanks, Stephen. Yeah, we're also, looking at how can we, look at cultural safety within the PCNs, and having Gracie support us to develop, some ways of measuring cultural safety in a culturally safe way. So that's something we're really working on. So a little bit about kind of what it looks like working with an evaluation team. And I'll jump through this pretty quickly and kind of focus more on the creation of evaluation frameworks here and some of those pieces. But basically, getting a sense of what the local needs are, developing out the plan, and then participating throughout the course of the project, whether that's at a steering committee level, within the evaluation working group or other working groups, and just being a really close partner within the work, and making sure that any data collection and reporting aligns with the needs of the project. So I thought I'd focus a little bit on kind of demystifying the evaluation plan or framework and kind of what you could expect to find in there. What if you were going to be working with an evaluation team, what would you be looking for in their evaluation plan, and what do we kind of include within ours? So a bit of a background on the project, some context there to kind of ground the framework within. And then it really focuses on the key questions that the evaluation is going to answer. And we have both the process related questions. So what was implemented? How was it implemented? Were the right people at the table, and did they feel included in what was happening? And then outcomes related as well. So for PCN, are we making progress towards the 8 attributes that have been laid out by the Ministry of Health? We can get into more specifics within each of those. So then additionally, how do we intend to get the answers to those questions? So these would be our methods of data collection. Are we going to be using surveys? Are we using interviews? Is there administrative data that's available? I see Kathy from the HDC on here. So we've been exploring how we might be able to use that kind of information that's stored in the HDC to look at some of our evaluation questions, as well as data that the Ministry of Health has, data that might be in individual physician EMRs as well, and data that the health authority has as the kind of key partners there. And then what would be a general measure of success for that? So if we're looking at attachment, we're looking for increased numbers of attachment there. So kind of the basics in terms of what we're looking for within each of those methods. And then whose input is important on these questions? We would want to look from the perspective of the key partners that are at the PCN table and other key stakeholders who may or may not be represented at the steering committee or CSC levels, as well as how we're going to report back our findings. When would you expect to get information from the evaluation team? How would you expect to get it from the evaluation team? What's it going to look like? Is it going to be in one-on-one meetings? Is it going to be in written reports? And how often that'll be coming back? So that's kind of a high level there. So if we took one example kind of through this process here, for example, how is the project implemented? So a process related question. We would likely be using interviews with the key partners on how that was working, as well as looking at a review of project documents to understand how it was planned to be implemented, and then subsequently kind of how did that actually look? How did that play out? We'd be looking at what's learned from that implementation process. The key people that we'd want to speak to would be those who have had some involvement in that planning process of how it was planned and how it was implemented, and possibly some other stakeholders as well who have experienced how it was implemented. And then provide that in either a verbal report back to the steering committee, or in an annual report kind of format. So kind of an example there of working that through. I've also got a logic model to share, because some people like seeing things like this. This is one way that I like to see information being presented, is in kind of a one-page format here. So this is kind of a blanked out version from a specific PCN we were working on, and looking at kind of guiding this work by the overall mission of that PCN and the 8 PCN attributes that are part of why we're doing this work. Looking at the inputs in the first column, what's going into all of this work, the funding, the partners, how it's being structured and organized, what's happening. So that's the initiatives. How many PCNs are being created in that specific region? Who is being hired? Are there teams being created? What, so the kind of the what here, and then how to measure what's happening there as well. So things that you could count, for example, or check off of a list. And then we move into the outcomes. So how is this project having impact at the patient level, at the individual level? How is it impacting healthcare providers or community care provider or community resource providers as well, if the PCN has reached out to the community level partners, as well as communities and systems of care overall. So these medium-term outcomes are things that we're hoping that we can measure within the lifetime of the project. And then longer-term outcomes were things that are what we're moving towards, but may or may not be what can be measured within the course of the initiative. And that kind of wraps up my overall presentation. Stephen, was there anything you wanted to add before we open this up for discussion and questions?
No, I just one mention of just about the evaluation framework and the development of the evaluation plan early on. Mm-hmm. We will typically want to spend some time early on doing one-on-one interviews with some of the folks that are involved in the planning, as well as possibly identifying some that didn't get to be part of that planning, to understand, what kind of things that they would like to know about. And part of that is continuing on what Katherine was saying about making sure that this is utilization focused, but also useful for individuals that have some stake in this, that are really interested in it, and that we need to come back to and be accountable to. It also provides that opportunity for people to have ownership of this. This isn't something happening to them. It's something that they're involved with, that they own, and we're just there to help facilitate the process.
I'm going to stop sharing so we can see each other's faces. I'll find that easier for question and answer. But yeah, people are welcome to use the chat function to ask questions, or just blurt out any thoughts you have or anything like that, and we'll do our best to answer them. Christiane, I'm not sure if there's anything else that we were meant to do, or I'll assume you'll keep us on track here for anything.
Yeah. No, I think the chat function, or also just the hand, raised hand, would work as well. I'm just curious, how has Reichert and Associates worked on PCN evaluations in the past? You may have already touched on that. You have.
No worries. No, yeah, we touched on it very briefly, but yeah, we're working with Stephen, I'm not sure what our official count is exactly, but I'm working directly with 5 primary care networks and supporting their evaluations. And so it's looked like a lot of that front end work so far of understanding what the local needs are, what is going to be really useful to them to know as it goes along. And so a lot of what we're hearing is they want to know how the change is being experienced by the people who are being hired, by the care providers that are having to kind of change how they do things. So lots of kind of interview style connections, and feeding back that information as quickly as possible, so that especially in larger PCNs, they can continue to use that information as they continue to implement. They don't kind of get to the end of the project and wish they'd known that sooner. Also, working closely with each of the different partners and people that would have different types of data. So identifying kind of who in the health authority would be best positioned to provide any information on allied health providers that have been hired. I recently got to do a kind of a data interpretation with a set of allied health providers. So we looked at information that came out of what they charted, and I shared with them how I was interpreting the findings, because we were trying to understand team-based care. And there was a section that was on collaboration, so amount of time they're spending collaborating with others. So I just wanted to know, am I correct in assuming that this is collaboration with others and we could consider this team-based care, or is it something different? And so it was just great to have that kind of dialogue with them, so I know that I'm interpreting it correctly and they understand how I'm using the data that they're putting in, that it's not just kind of going into the ether, but somebody's looking at it, somebody's tracking it, somebody's kind of thinking about it and recommending changes back to the team about that. So, yeah.
Nice. And yeah, I'm just going to open it up to the floor. Are there any questions for Stefan and Katherine?
If you want to hear from Alan, the main types of evaluation: process, impact, outcome, summative. Which of these four best captures the value proposition of PCNs to funders? I guess that would be a question for the Ministry of Health somewhat, I'm guessing. Alan, I'm not sure if you want to clarify your question here at all, but what I'm guessing is you're trying to see what would speak to the Ministry of Health in terms of what they want to know at the end of the day.
Yeah, no, thanks, Katherine. So for those of you that don't know me, I'm a rural GP in Oliver in the South Okanagan. I also co-chair the Joint Standing Committee on Rural Issues, which is targeted funds through the Rural Subsidiary Agreement. And we successfully secured funding through the JSC and the Rural Coordination Center to actually do and provide rural supports for PCN engagement. So I'm just thinking about taxpayers or the funders in the system as a whole. We've invested and encouraged divisions to think about the summative evaluation, capturing the stories of their journey, because we think the stories, have the biggest impact on persuading folks that we're doing the right thing. But I do see value and merit in the other pieces. And so I'm just curious to know, from a Joint Standing Committee perspective, we're very happy with summative evaluation, but is there a better value proposition, as you say, Katherine, to maybe the ministry and finance at the ministry, for example? What are they actually thinking about when they look at our journeys? What has the biggest impact with them? Because we've invested in summative evaluation, thinking that's the best way to go about it.
Mm-hmm. Stephen, do you have anything jump off the top of your head on that one?
No, because we're not aware of a provincial framework in that area. I mean, I would agree with you. Like, if I were looking at it from that perspective, I would say it's great to know what we've accomplished, but if we don't know how we got there, right? We need to understand how we got there. Because if we ever try and do this again, or if we ever want to learn from things, and as we know, if we're working in healthcare, we see things come, and we see, and hopefully we can build on what we're doing over a long period of time. That's how you create the system. And if we don't know how we got there or what all the building blocks were part of that, then we're kind of lost. So, I think they both are significantly important. The summative component is obviously the glitzy part that tells us that we did something and we accomplished something, but how we got there we need to know that.
Mm-hmm.
Great. I see Alan gave a thumbs up, and so it sounds like that answered his question or enlightened further on the question. I see that Katherine has her hand up. Katherine Brown, if you'd like to share your question.
Yeah, it's actually not a question, it's just a comment, and I certainly do not have a response for Alan's question, but I just came out of a previous role working for the Doctors of BC as a primary care network liaison, and I sat in on a few of the provincial level PCN evaluation community of practice meetings, along with a few of the kind of calls that we had with Wave 1 communities around, what are some of the indicators that may make the most sense to start looking at, recognizing that the ministry has not finalized sort of the provincial framework for evaluation. And the last I had heard was that they were working on an evaluation that was really focused around the 8 or 9 PCN attributes. And so looking at how to potentially evaluate that. And I do know that some of the work that came out of the community of practice as well includes 11 different frameworks that possibly Katherine and Stephen have supported and worked on, that different PCNs in different stages of their PCN journey have developed and sent into GPSC, and they collated it into one huge kind of document around, this is what PCNs are currently trying to measure, and then deliver that back out. So it is out there in circulation, and I'd be happy to include that in like the notes for this PCN forum going out as well, just to sort of inform some of that work and to see what others have been doing to date.
Just going back to Ellen, to your question and to the point around about the formative type of the evaluation component. When we think about, I'll use Chilliwack as the example. When we think about the work that they're doing, the engagement that they're having with their Indigenous communities as part of their work, learning how they're doing that and learning what they're doing and how they're implementing those engagement strategies is really important to divisions across the province as we do this work. If we don't learn from that, we're all kind of sitting there trying to figure it out individually.
So Stephen, just to that point, and again, looking at the Joint Standing Committee and the other collaborative committees, it's also a good demonstration. We don't have to duplicate the expenditures. So if we can cross-pollinate across divisions, I think that's huge, actually, right? And that's really good value on the investment.
We're seeing with the development of the evaluation frameworks, even, the very first one is a learning component. The second one, you're still learning something. But by the time you get, to Katherine's point, I think we're at 14 or 15 PCNs across the province that are up and running right now that we're involved in the evaluation of and supporting. It's taking us less and less time to develop the evaluation plans for those. And so the savings are there, right? Because, we're learning. And as long as divisions are okay with sharing, which, I very rarely hear somebody say we don't want to share something. That as time goes by, they are much easier to do.
I think that's why we're seeing a lot of interest in this event today. People just wanting to have a chance to talk with one another about PCN and what it means and what it looks like. So, yeah.
I'm seeing no other questions or comments, but I actually have a question. I'm curious around some of the quantitative measures. So not just the qualitative measures, but of course, one of the goals is increased attachment. In your past evaluations, were you accessing new Ministry of Health attachment data after like a year or two to be able to quantify increases in attachment? Or what are the quantitative components of the evaluation in terms of how you're using or what data sets you're using to measure certain things like patient outcomes and attachment?
Yeah, great question. And certainly attachment's one that's had a lot of difficulties in trying to figure out how we're going to measure this and what the different data sets mean. And so currently the Ministry of Health is providing the zero fee attachment code to each PCN. So you can see how many providers were billing the zero fee attachment code over the last period, as well as how many patients they've attached in that method. But of course, that's an imperfect measure because it relies on people billing for something that doesn't actually pay anything, and also doesn't account for unattachments on the other side. And so That's one way we've been looking at it, is that data that they provide, and that's one of the ways the ministry will be looking at it as well. We're also using survey tools like the CAMP tool out of UBC. And so this is basically an MOA survey where each year or quarter, or however often you decide to implement it, it asks for the patient panels of the physicians that are, and NPs that are part of the clinic that MOA is working at. So a way to kind of capture some overall capacity within that area. And that survey also lets you look at some of the components of access, like third next available appointment, availability of next day appointments and things like that, same day appointments. So that's another way we've looked at doing it. And I'm trying to think if there was another option that I'm forgetting at the moment, but those are kind of the keys. I mean, another way has just been the division kind of maintaining a database, for example, and checking in with their clinics on a regular basis. And so having the evaluation support that kind of very intense data work to maintain a database like that would have how many patients are attached to each clinic, but some have decided to go that route to have the best possible information to use. But yeah, answer that question.
Yeah, no, that was a great answer. I'm wondering if there are folks with experience with PCN evaluation on the line, like from other divisions who have gone through this process, and what you learned from the evaluation process, or how are ways that you could see the evaluation process being improved. Yeah, I'm wondering if other folks on the line who've been through the process might have some further things to share.
One great place for information about this kind of stuff too has been the community of practice for evaluation. And so that's something that's open for people to join and learn more about what's happening evaluation wise across the province, ask questions, and learn from others too. So like Katherine Brown was saying, might be a good resource for us to include in here. I'm not sure if there's a way to access kind of previous meetings and minutes and stuff like that to review. But these are a couple of questions that we've been tackling kind of as a community of practice and learning from how everyone has been doing it. And so that's been really helpful.
One of the other things is we've engaged Gracie Kelly from Chilliwack to do some webinars. We're just facilitating them for her. And some of them include some attributes that she is for cultural safety in doing health work in a good way. And we've put those on our website. We're hosting them there, but I think that we can definitely share them out from there if anybody's willing to or wanting to see what she's doing and learn about what Chilliwack is doing. So that's very shareable right now to see. It can also drive some of the process of evaluation when you're thinking about, who you're engaging in some of that stakeholder and development of the evaluation framework. I know that, one of the things that we learned, we knew, and we didn't do well early on. So evaluations can learn through this process as well. One of the things we didn't do very well early on is we were very intent on engaging with indigenous populations and ensuring that they were involved in the development of the framework. And I did get a very quick reminder that does not include Métis, and that we need to be very intent on ensuring that we identify communities and populations in a good way. And so there were some learnings that way, but just thinking about if you're developing evaluation, if you're developing a plan and you're engaging stakeholders from your community, that you don't lump populations together, that you think about those in a very critical way.
Tracy.
I think for physicians involved in PCN and any kind of work that we do, evaluation is like no offense to our wonderful presenters, not the most exciting part of the process, and sometimes a frustrating part of the process, because we just are really outcome focused and just really want to get there. And then we want people to trust us when we say, yeah, this is really working. We just kind of want to be agreed with and allowed to carry on with what we think is really working. So I'm just wondering how you ensure through this process the physician engagement piece, and really I guess that goes across the board now for PCN with the other allied health professionals, and how you're ensuring you're getting a broad voice, because I can see that the people who've been involved in PCN planning and the PCN working groups, they're of course going to participate in the evaluation. How do you ensure you're getting participation from the physicians or other folks within community who have felt alienated by that process, or who might not have been part of the process, just so that we're not really just getting that quantitative or that sort of narrative data simply from the people who have been part of it the whole time, if that makes sense, if that's...
You mean evaluation is not the most exciting top of mind thing that you're...
It is today, Stephen, and this moment it absolutely is. But I just want to clarify that maybe not all of the physicians in our divisions feel that way. And yes, I appreciate the work you do for sure.
No, and you know, one of the things that, you know, as Katherine mentioned earlier, one of the things that we really, you know, it's really important to be able to bring back information in a useful way, in a way that, you know, people can see themselves in it, that makes it important for them, and can tell a story that they can say, yeah, okay, I didn't know that, or I knew that this worked, but I had no idea that it didn't work, that it worked that well. Or you mean I'm doing all this work and it's not having the impact that I thought it was, and I should do something different, because time is valuable. And so why waste my time on something that's not working? I think that, you know, Katherine, if you have things to add here, but I think a prime way is making sure that we're connecting with our primary care providers and ensuring that the information that is coming to them, not only can they see it, but they can understand, how do I use this information? And so that's a big component of this. It's not just bringing it back and saying it's colorful, it's a good story, but how do I use this? How can I take this and do something differently, or continue doing what I'm doing right now, or stop doing something that I'm doing?
Yeah, and I'll say to add to that, a method that is, you know, not a new method by any means, but one that we're trying to use a little bit more in a specific way is the focus group. And so in a focus group setting, you can both gain information from the people you're looking for, as well as they can learn from each other. So it's not just a pull of information the way a survey is, but using kind of more interactive methods that might be enticing for a family physician to take part of, where they get the opportunity to learn from each other, share what they've been doing PCN-wise, what they don't understand PCN is. We're going to be doing a few specifically around some of the AP contracts that are available through PCN, and just getting the family physicians to talk to each other about those, and then be kind of a facilitator of that conversation, get the data we need to understand what's working well and what's not, but have it be less of a one-way process than some more traditional data collection methods might be.
Does that answer that, Tracy?
I just know doctors aren't always the easiest group of people to work with, so thank you for persevering.
You know, time is sometimes challenging, just in terms of having that amount of time to be involved. But physicians do really great work around the province. I very rarely do we try and contact a physician to talk about something that they're doing, and that during the interview, they're not excited about it and not wanting to talk about it. So, yeah.
Great. So another question I had, seeing that perhaps there's no other questions in the group, is just around, without like naming any division particularly, but seeing as you've been through this process with a few PCNs now, what are some of the findings that surprised you, or you think might have surprised like the CSC or the PCN steering committee? Like, what are maybe some common threads in terms of findings or some limitations that the evaluation has highlighted? Just curious around, yeah, some of the findings, and maybe that will generate a bit more discussion.
Yeah, I'm trying to think of some specifics. A lot of the divisions or PCNs that we're working with are kind of in the earlier phases that haven't had a lot of time to implement at this point. So as I was saying before, lots of time in you know, what's working and kind of where are they at within their implementation. I'm trying to think of anything that surprised me along the way so far. I think it's more a lot of confirming what we were expecting to hear, like how are we going to measure attachment and how are we going to measure access? What is happening provincially? Those kinds of questions coming up that are kind of common themes across the different projects. Steven, I saw you take yourself off mute if you have a thought.
Yeah, one of the things that I've seen in some of the divisions is, you know, just implementing a service plan as complex as this, and some of the challenges that divisions are facing with this. I mean, just, you know, going back to some practical things around recruitment of NPs, recruitment of physicians as part of their service plan. These are all real challenges that divisions are facing. Bringing doctors and healthcare providers together in the same room and talking and speaking common language in committees and working groups is a learning component for people. And so just watching that process right now as people work through that, and as Katherine mentioned, we're still in kind of, you know, almost all of ours are in kind of early days of that. Watching the healthcare, the working between the PCN, the committees, where you have the health authority and the divisions, has also been kind of an interesting watch of how they are now starting to work together in a way that, you know, we didn't see that early on. We didn't see that in a GP for me. We saw them at the same table. We saw them talking. We saw them doing planning, but not working in the same way that they are working right now, which is really interesting from an evaluation perspective, watching that whole relationship and how they're becoming more of a partner in healthcare and primary care within their regions is really kind of interesting.
Wow, that is really interesting, and it's interesting to learn more about the Chilliwack experience so far, and really wanting to capture like an indigenous voice in the evaluation process. Like indigenous partners at our table, for example, will often say like attachment is not always a measure that makes sense to us. What about the quality of the attachment, right? Is the experience culturally safe? Is the you know, can I access my GP or my nurse practitioner from my remote community? Like there's just a lot of other, you know, measures that go into measuring attachment other than just the actual number, right, of how many folks are attached or unattached. And so it's just interesting, how do you capture that, like the quality of attachment, for example, that's so important to some of our partners.
Yeah, for sure. I'll defer to Katherine on some of this, but, you know, definitely, how do we break down it, using your example of indigenous communities and indigenous people accessing primary health care? You know, it's a scary thing. Primary health care has not been a safe place for indigenous people historically. And so how do we change that? How do we break down those barriers so that there is attachment, and that attachment is good, it's meeting their needs, and working for them? I mean, it's a really good question. Katherine, I defer to you, like what kind of measurement processes we have, but and I know that you were saying that there is some things being worked on.
Yeah, exactly. So that kind of patient level experience survey to get a better sense of what is important about a good attachment. So is it, having same day access? Is it seeing your own care provider, or would you rather have access to somebody who has access to your information and can help you that day, versus waiting for your specific care provider, because it's going to mean different things to different people. So having a better sense of that quality piece is definitely something that most of the PCNs are more interested in than their attachment number.
And just kind of building on that, developing those relationships in a way that the relationship itself becomes safe. And sometimes, I was talking with one community more recently. We're doing some health planning with them, and they have a physician that flies in once every 2 weeks, and it's often a different physician that flies in every couple weeks, and you can tell that people would really like to access the healthcare. They would really, and by definition, I guess they're attached in some way, shape, or form. But is that a good attachment? Is that working for them? Is it working for the community? Is it providing the community what it needs in terms of access to primary health care? Because that's how you build that system of care. And I would say no, even though, by definition, we might have it there, right?
Right. I'm also curious to understand a little bit more, like from the provider perspective, right? What are some of the metrics that the physicians are saying are important for them to learn, like, or to know more about? For example, is it lightening their load? Is the PCN experience? But I guess because the work that you've worked on so far is in the developmental stage and not yet at that finding stage, we've yet to kind of glean into that. But I would be super curious in the future to see, right, what the general findings are on that, and if the providers are feeling that some of the goals that are intended through the PCN process are being met. I don't know if there are any closing comments from anyone or any final questions. If not, we could end a little bit early and rejoin our next session. I've put in the chat here. That's how I know you've all been able to join this session here, but if ever you were kind of wondering how to get to your next session, you can just click that link. There's an exhibitors hall from 2:30 to 2:45, and at 2:45 there's our third breakout groups. So any closing comments, and perhaps if not, we will just end a little early. Thank you very much, Katherine and Stefan. This was highly informative. And I know for me, as we embark on the PCN process, it was really good for me to learn more around how the evaluation framework is constructed. And yeah, thank you very much for your presentation today and for everyone's participation.